Welcome again. It's 21st Century Hardcore Health here with your host, Dr. Noah. I'll be reviewing some of the scientific literature of the last week to be able to give you the health and happiness that you deserve, get you away from drugs and surgery. So let's go right into the first study, Proceedings of the National Academy of Sciences, May 2009. This was a study done at the University of California at Irvine, and they were looking at fats. Now there's good fats and there's bad fats, and of course this is one of the good fats, an oleic acid. I was able to find in terms of not only helping you with your memory, but also help you with your appetite. And this is primarily seen in lots of olive oil, which is a great type of oil to use for cooking, putting on salads. So look into that. Caffeine withdrawal headaches explained had to do with in terms of addictive centers up in their brain, just like other type of drugs that happen like that. From the University of Vermont and Johns Hopkins found that this withdrawal, which is caffeine withdrawal, headaches, fatigue, feeling less alert, difficulty concentrating, had the same type of reactions as any other drugs, and that was in the Journal of Psychopharmacology, May 2009. Poor sleep leads to poor prognosis after stroke. Talk a lot about that on my TV show, that sleep is one of the three primary health factors that the National Institute of Health and the Center for Disease Control has shown to be effective in terms of health, and being not sleeping well has a poor prognosis. Means after a stroke, those people do less if they're not able to sleep. Also having an office in Napa, California. Here this study in the Journal of Epidemiology and Community Health Sciences, May 2009, showed that a half a glass of wine was able to add 5 extra years to your life. This was a Dutch study. These were patients greater than 50 years old, and that was across the board in terms of reducing death by all causes of death. So very exciting there. B vitamins, an important part of good health, was able to help with allergies and asthma, and one particular of the B vitamins was folic acid or folate, was able to show fewer of these allergic type of immunoglobulin E factors of antibodies, and they were able to show in Allergy of Clinical Immunology, May 2009, 40% better in terms of wheezing and a 16% decrease in asthma just by taking a B vitamin. That's only from the most prestigious medical school right now, Johns Hopkins Medical School, and they looked at ages between age 2 to 85. First study of combining dietary factors and age-related macular degeneration. This is a Tufts University study showing that the major factors in terms of preventing this #1 cause of blindness wasn't due to drugs or eye drops, was in terms of good lifestyle type of changes. A low glycemic index diet, certain type of antioxidants, vitamin C, vitamin E, zinc, lutein, zeaxanthin, and omega-3 fatty acids. And your drug doctor can see that on Ophthalmology, May 2009. That diet and lifestyle is the best that medicine has to offer. Smoking and high blood pressure account for 20% of deaths, premature deaths. This is a Harvard study. And it showed that with smoking, there's 467,000 premature deaths. High blood pressure, if it was, once again, making some changes and helping produce, would able to save 395,000. Obesity, 216,000. It's the most comprehensive study looking at lifestyle and chronic diseases, and that's what they found out. That low intake of fruits and vegetables could save 58,000 people. Bad fats, 15,000 lives could be saved every year. Low omega-3 fatty acids, you increase the omega-3 fatty acids from fish oil, was able to be saved 84,000 people. High trans fatty acids, reduce that out of your diet, would save 82,000 people. Not exercising, that would save 191,000 people. Reduce your salt, 102,000 people would be saved every year. Another study in American Journal of Respiratory Critical Care Medicine, May 2009. Low vitamin D linked to asthma. Yes, this was a study looking at children between 6 and 14 and showed a 28% improvement by increasing your vitamin E and vitamin D intake. Quercetin reduces blood pressure and low density lipid cholesterol, the bad cholesterol. Randomized control study, 150 grams per day for 6 weeks. And this is the quotation from the British Journal of Nutrition, May 2000. Provide protections against cardiovascular disease. This is what you see in lots of fruits and vegetables. This quercetin, the phytochemical. Magnesium for severe congestive heart failure. This is a Moscow University study in International Journal of Cardiology, May 2009. Randomized control study, once again, better than most drugs in terms of science, using a particular type of magnesium that's used over a lot in Germany by Hans Nieper, magnesium orotate, quite a bit, about 6 grams or 6,000 milligrams per day for 1 month, and then 3,000 milligrams per day for 11 months, showed an increased survival of basically about 25% greater over the placebo effect. And then signs and symptoms improved 38.5% versus the placebo actually got worse by 56.3%. Reduced saturated fat with fat reduces heart disease. We talk a lot about the bad kind of fats, the animal fats. Replace it with good type of flaxseed oil or olive oil, and was able to show overall 26% reduction in coronary death. American Journal of Clinical Nutrition, May 2009. One of my favorite herbs, curcumin or turmeric, benefits traumatic brain injury. See that a lot in car accidents. Also, I have the opportunity to work on the Iraqi and Afghanistan soldiers coming back that have been blown up and hurt. In this study that showed that this was able to reduce the what's called a brain injury there, and as the quotation said, new line of therapeutic treatment for TBI patients. And that was in Neuroscience, April 2009. And there was a hydroxycut recall, so be careful. Just like natural things can be good or bad, be careful where you buy your things. Very, very important there. Poor diet, low exercise leads to breast cancer. This was a childhood birth to 13 years old. The biggest risk factor was not, going in for checkups and things like that. The biggest risk factor was poor diet and low exercise contributed to an increase in breast cancer. And that was in pediatrics, May 2009. Study predicts huge increase in cancer. University of Texas Anderson Cancer Center. This is the leading cancer research center in the country. It says over the next 20 years, the number of new cancer diagnoses each year in the U.S. will increase by 45%. Very scary. On my TV show, we've gone over that World Health Organization and other organizations said by 2009, cancer will surpass cardiovascular heart disease as the #1 killer. So, and we go over why you can reduce those chances 60-70% of having cancer. Lifestyle changes can prevent breast cancer. Here we go. 38% reduction in breast cancer by the Annual Institute of Cancer Research, May 2009, by eating better, exercising, and a low body weight. Those three simple things could reduce breast cancer by 38%. Harvard study in 2008 evaluated all the scientific literature of cancer causing. They didn't see biotechnology, new type of mammography, other types of invasive things that don't work. They concluded that lifestyle choices would be able to reduce all cancers by 70%. So that's why you watch this, to be able to protect you and your family in terms of things that do and do not work, and a lifestyle is best. So thanks again for joining me. We'll see you next time. Be healthy, happy, and prosperous.